Halifax. As a young girl growing up in New Glasgow, Keisha Jeffries always knew she wanted to do something to help her Black Nova Scotian community. After 2 years working as a nurse in the neonatal intensive care unit at the IWK Health Centre, Jeffries decided to go back to school to pursue graduate studies. Keisha Jeffries, a PhD student at Dalhousie University, hopes to gather more data on the underrepresentation of Black nurses and how that impacts overall health in the Black community. Yvette d'Entremont, Star Metro. The Dalhousie University PhD student is now conducting research described by one of her thesis supervisors as groundbreaking. She's gathering data to show how the underrepresentation of Black nurses in healthcare settings and leadership roles impacts those nurses and the Black community at large. Having an absence of Black nurses in a position where they're able to influence policy has a negative effect on the Black community itself, and we know this because we see the Black communities with more people having poor health compared to the general Canadian population, Jeffries said in an interview. What we're seeing in Nova Scotia and across Canada is that Black nurses are significantly underrepresented in specialty areas of nursing, so in intensive care units as well as emergency units. They're underrepresented in both formal and informal leadership roles, so as nurse managers or charge nurses. Black nurses are not seen in those areas. Article continued below. Jeffries said Black nurses also tend to be more concentrated in non-specialty areas as well as unlicensed clinical roles, such as continuing care assistants or personal care workers. Read more. Opinion, Vicky Mokama. When Black women tell the plain truth, the world is sure to demand an apology. Black municipal employees protest workplace racism outside Halifax City Hall. Stress of Halifax Infirmary are crowding taking a toll on staff. Union Shea said this is problematic on several fronts because racism is still very much alive and well in this country, even though many average Canadians don't think it affects us to the extent that it impacts Americans. In terms of practice for a Black nurse, there's still a lot of racism that's felt as we are practicing in the units or whether it's as a Black nursing student. You're still feeling a lot of that impact. Article continued below. Jeffries explored these issues in a paper she wrote for her master's degree, titled, Understanding the Invisibility of Black Nurse Leaders Using a Black Feminist Post-Structuralist Framework. The paper was published in the Journal of Clinical Nursing in May. What I chose to focus on was the invisibility of Black nurses in healthcare practice, because for my PhD thesis I'll be looking at nursing leadership amongst Black nurses, she said. I just wanted to begin to get into the literature, looking at what was available related to Black nurses and also what were some of the challenges and issues that they are facing. One of the challenges is there currently isn't much Canadian literature to draw from, something Jeffries intends to start changing. We don't do a lot on race-based research, which is unfortunate as we just don't understand the situation. We have a very general idea, but we don't know the specifics and we're really lagging behind, she said. Jeffries said the United States is moving forward a bit more, since they have quite a bit more literature on Black nurses in practice, Black nursing students and the health of African Americans. But Canada has much more work to do in this area, she said, and it just really needs to be considered as a priority. In order to do that, collecting data and gathering evidence to show the extent of the problem is critical, Jeffries said, because there are still people who believe racism doesn't really exist in Canada and that there's no need for race-based research or dedicated funding for specific groups. This evidence is key to changing policies and practices, so Jeffries said the goal of her PhD research is to gather enough that can then be used to influence and change policy not only in organizations like healthcare centers at universities in Nova Scotia, but across Canada. This problem is nationwide. I'm looking at a paper now dealing with food insecurity amongst the Black community, which is huge. Then you look at the employment rate in education, job opportunities, job security. All of these little pieces I feel like my research could potentially help to inform just by generating some evidence, she said. Hopefully more researchers will be interested and will be able to participate, because right now if you're not funded you're not able to do the research. If it's not a funded area, then it really flies under the radar and no one picks it up. I am trying to bring it above the radar, get a little buzz happening. The underrepresentation of black nurses in healthcare settings also has negative repercussions for black patients. Jeffries said it's a reality for many black Nova Scotians to start mentally preparing for how they're going to be treated before a medical appointment because of past bad experiences within the medical system. That also discourages people from actually seeking care in the first place, which is why we see people of color, specifically black people, tend to have higher rates of chronic disease, a later disease diagnosis, and often a worse disease prognosis, she explained. Literature is starting to come out showing individuals are very hesitant to seek care, especially if they're feeling they're not seeing anyone who can understand their problem or somebody who actually looks like them, because that can go a long way. Gail Tomblin Murphy is a professor and director of Dalhousie University's School of Nursing and is co-supervising Jeffries' PhD thesis. What Keisha is leading up is some incredibly important dialogue that has not ever hit the tables in the way that it needs to in universities as well as in practice settings, Murphy said. What we're learning from Keisha and others through her work, which I think is just the beginning of some incredible work that needs to be done, is we are starting to hear and to listen to these issues in a way that is a much deeper level, with a view of how this evidence is going to change the system. Murphy believes Jeffries' work is important because it's delving into uncharted territory that will lead to positive changes. It's also key to helping build a better understanding of how systemic racism affects people by highlighting their lived experiences. We've got some incredible work that Keisha's doing, and we're going to have to pay close attention to it, Murphy said. In practice environments we still hear stories where people refuse the care of providers who look different, and it's not blaming one organization or any organization. This is where we are, Murphy said. Diversity and inclusiveness need to be more than just words. She believes Jeffries' work is only the beginning of important conversations that are needed to move forward. Although she acknowledges change will take time, Murphy is optimistic. There will be changes, and it will be through the new and young leaders coming forward that will make us and ask us to do things differently in education, in practice, in communities, Murphy said. The expectations are going to be different, and the bars are going to be raised in ways that are very different from what they've been in the past. So this is really exciting. Yvette D'Entremont is a Halifax-based reporter covering health, environment and education. Follow her on Twitter, @ed'entremont.